What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the infamous X-ray vision. So to give you context, I am a night shift X-ray tech, been doing it for about 4 years. And the X-ray vision, my teacher always told us about this infamous X-ray vision. As far as over the amount of x-rays and experience and patient body habitus that you would see, you could kind of develop x-ray vision to the point where you don't have to be struggling to know where to position your C-arm, your technique. You can kind of gauge at the patient, and you can kind of already in your head kind of tell what the image is going to look like, maybe what adjustments you have to make prior to, like it's something that you just kind of can tell. And at first I was like, there's no way that you can develop x-ray vision in a way. And then slowly over time, and ungodly amount of overtime, I slowly saw people, and I've noticed trends in both the body habitus and some of the people who just come in all the time to your hospital, and you can kind of tell how their lung is. And you truly kind of already in your brain start to see, okay, we probably have to angle up, angle down, or we probably have to adjust the technique here or there before even shooting it, just based off of a vision, the x-ray vision in a way, you could say. Every tech kind of over the years will kind of develop their own, and it's something at the beginning that you're inexperienced, or even there's some techs who just never paid attention. But I've noticed over the times, certain people, certain builds, I'll use myself. So the Miguel patient is typically someone who is between, 6 foot, 6'5", kind of big, not too big, just in between, probably 250 to 300 pounds ish range. And typically those kind of people have a tiny lungs. I didn't know that I had tiny Miguel lungs until I got my x-rays done during COVID, when I got COVID. And I figured out I had tiny lungs, which ended up making sense, because when I had asthma, it would hurt to breathe, and I would literally feel my diaphragm all the way up here. And then other times you see people that are very, very skinny. And if they're skinny and they're bony and they're kind of hunchback, you best believe that I could almost bet my paycheck that they will have long lungs. And every single time I look at them and we lift them up, or they tell us, I have a bony back, be careful. And sometimes it's literally the shape of a Dorito in the back. And you're like, how does your spine become like a little Dorito chip in the back when it's not supposed to be like that? You will literally see them all the time. Majority of the hunchback people, I don't know what it is about the skinny people with these big lungs and they can't breathe. I see it all the time. There's sometimes that the bigger patients do end up having bigger lungs, and it takes, the most I've ever had to do was 4, because they were huge. It's something that amazes me to this day. Certain people, you can just kind of tell they have tiny lungs, or other times you're just thrown off, which is something surprising to me. But yes, the x-ray vision is both a thing that you can kind of develop over the years of doing x-rays, and you kind of see trends, and you can kind of see, or even people that you see over and over in the emergency room or wherever you work at, you can kind of tell how their lungs are going to be. So that is something that's both a myth / it can happen. And you'll just slowly kind of acquire that knowledge and ultimately become a better tech, because it will cause you to have less repeats, get better images, less, exposure to the patient. And yeah, it's been your boy Miguel. We'll see you on the next one.